Hi y'all. Okay, I want to do just kind of a quick summary or a lesson overview about 33, I think it's point 3, whatever section is the respiratory system. So if you think about it, when medics examine an unconscious accident victim, one of the first things they do is to check to see whether or not the person is breathing. So that's one way to determine whether there's still a life to save. And why is there such a close connection between breathing and life? All cells in our body, especially brain cells, require a constant supply of oxygen for cellular respiration. So without oxygen, many cells begin to die within minutes. The cellular respiration system works together with the circulatory system to provide our cells with oxygen. So any interruption in that vital function can be fatal to your body. So what is the function of the respiratory system? Well, the human respiratory system picks up oxygen from the air that we inhale, and it releases carbon dioxide into the air that we exhale. So for organisms, respiration means that the process of gas exchange between a body and the environment. So the human respiratory system picks up oxygen from the air that we inhale, and it releases carbon dioxide into the air we exhale. So the circulatory system links the exchange of gases in the lungs with our body tissues. And the respiratory system consists of the nose, you can't touch it here, but the pharynx, larynx, trachea, the bronchi, and the lungs. So to keep lung tissue healthy, air entering into the respiratory system must be filtered, moistened, and warm. So hairs lining the entrance to the nasal cavity start the filtering process by trapping large particles. Incoming air is warmed in the intranasal cavity and sinuses. These areas produce mucus that softens the air and catches even more dust particles. So air moves through the nose to the cavity at the back of the mouth called the pharynx or the throat, which serves as a passageway for both air and food. So air moves from the pharynx into the trachea or the windpipe, and when you swallow food or liquid, a flap of tissue called the epiglottis covers the entrance to the trachea. This ensures that food or liquid goes into the esophagus. So between the pharynx and the trachea is the larynx, which contains two highly elastic folds of tissue known as the vocal cords. And when muscles pull the vocal cords together, the air moving between them causes the cords to vibrate and produce sounds. Now, the mucus produced in the trachea continues to trap inhaled particles that come in. The cilia lining the trachea sweeps both mucus and trapped particles away from the lungs towards the pharynx, where they can be swallowed or spit out. So from the trachea, air moves into two large tubes in the chest called the bronchi. There's some really good pictures in your book. Each bronchus leads to one lung. So each lung, the large bronchus, divides into a smaller bronchi, which lead to even smaller passageways called the bronchioles. And the bronchi and the bronchioles are surrounded by smooth muscles controlled by the autonomic nervous system that regulates the size of the air passageways. So the bronchioles continue to divide until they end up at a series of really tiny air sacs called alveoli. And the alveoli are grouped into clusters like bunches of grapes. It's a network of capillary that surrounds each alveolus. So how are oxygen and carbon dioxide exchanged and transported through the body? Well, oxygen and carbon dioxide are exchanged across the walls of the alveoli and the capillaries. Chemical properties of blood and red blood cells allow for efficient transport of genes throughout the body. So when the air enters the alveoli, oxygen dissolves in the moisture on their inner surface, and then it diffuses across thin capillary walls into the blood. So oxygen diffuses in this direction because the oxygen concentration is greater in the alveolar than it is in the blood. So carbon dioxide diffuses from the blood into the alveoli because the concentration is greater in the blood than it is in the alveoli. So the air that you inhale usually contains 21% oxygen and 0.04% carbon dioxide. Exhaled air usually contains less than 15% oxygen and 4% carbon dioxide. So your lungs remove about a fourth of the oxygen in the air that you inhale and increase the carbon dioxide content of that air by a factor of 100. So diffusion of oxygen from the alveoli into the capillaries is a passive process that stops when oxygen concentration in the blood and the alveoli is the same. So hemoglobin actively binds to dissolved oxygen, removing it from plasma and enabling diffusion from the alveoli to continue. Hemoglobin binds with so much oxygen that it increases the blood's oxygen carrying capacity more than 60 times. So when carbon dioxide diffuses from body tissues to capillaries, most of it enters the red blood cells and combines with water, forming carbonic acid. The rest of it dissolves in the plasma, or it binds to the hemoglobin and proteins in the plasma. So these processes are reversed in the lungs, where carbon dioxide is released into the alveoli and exhaled. So what mechanisms are involved in breathing? Well, the movements of the diaphragm and the rib cage change air pressure in the chest cavity during inhalation and exhalation. So the lungs are sealed in two sacs called pleural membranes inside the chest cavity. And at the bottom of the chest cavity is a large dome-shaped muscle known as the diaphragm. It's like your lungs come down and they sit right on this diaphragm. So when you inhale, the diaphragm contracts and flattens. Muscles between the ribs also contract, raising the rib cage. And these actions increase the volume of the chest cavity and create a partial vacuum inside the cavity. So the atmospheric pressure fills the lungs as air rushes into the breathing passages. And during exhalation, both the rib cage and the diaphragm relax, decreasing the volume of the chest cavity and making air pressure in the cavity greater than the atmospheric pressure, and that causes the air to rush back out of the lungs. So exhalation is usually a passive process. But to blow out a candle, to speak, to sing, or yell, you need more force than just passive exhalation. So the extra force is provided by muscles between the ribs and the abdominal muscles, which contract vigorously as the diaphragm relaxes. So breathing works only because the chest cavity is sealed. So if a wound punctures the chest, even if it does not affect the lungs directly, air may leak into the chest cavity and make breathing impossible. This is one reason why chest wounds are always serious. So you have some conscious control over your breathing when you swim or play an instrument, but breathing is not purely voluntary. Your nervous system has final control of your breathing muscles, whether you are conscious or not. Breathing is initiated by the breathing center in the part of the brainstem called the medulla oblongata. Sensory neurons in or near the medulla and in some large blood vessels gather information about carbon dioxide levels in the body and send the information to the breathing center. Okay, so when it's stimulated, the breathing center sends nerve impulses, causing the diaphragm and the chest muscles to contract, bringing air into the lungs. So how does smoking affect the respiratory system? Well, the chemicals in tobacco smoke damage structures throughout the respiratory system and have other negative effects on your health also. The three most dangerous substances in tobacco smoke are nicotine, carbon monoxide, and tar. Got that? Nicotine, carbon monoxide, and tar. Nicotine is an additive stimulant that increases the heart rate and the blood pressure. Carbon monoxide is a poisonous gas that blocks hemoglobin from binding with oxygen, so it interferes with the oxygen transport in the blood. And tar contains at least 60 different compounds that are known to cause cancer. So tobacco smoke paralyzes the cilia in the trachea. Remember, that's the little hair-like projections, allowing inhaled particles to stick to the walls of the respiratory tract or enter the lungs, and smoke-laden mucus to become trapped along the airways. So irritation from accumulated particles and mucus triggers a cough to clear the airways. So whenever you're coughing, you're trying to clear all that stuff out of your lungs. Smoking also causes the lining of the respiratory tract to swell. So it reduces the airflow to the alveoli. If it swells, not as much air is going to go in there. So damage to the respiratory system from smoking can become permanent, and it can lead to diseases such as chronic bronchitis, emphysema, and lung cancer. Smoking does reduce your life expectancy. Only 30% of male smokers live to the age 80, but 55% of male non-smokers live to at least that age. Chronic bronchitis. So you're probably saying, well, what's the big deal about chronic bronchitis? Well, the bronchia become inflamed and clogged with the mucus. Smoking even a moderate number of cigarettes on a regular basis can produce chronic bronchitis, and affected people often find simple activities like climbing stairs difficult. Treatments can control symptoms, but there is no cure. Emphysema. This is a long-term smoking can lead to this. It's the loss of elasticity and the eventual breakdown of your lung tissue. So people with emphysema cannot get enough oxygen to their body tissues or get rid of the excess carbon dioxide. And there is no cure for emphysema, but it can be treated with medication. Lung cancer is particularly deadly because by the time it's detected, it's usually spread to all other areas of the body. Few people diagnosed with lung cancer live more than 5 years. And about 87% of lung cancer deaths are due to smoking. So smoking also negatively affects the circulatory system. It raises blood pressure by constricting the blood vessels, which forces your heart to work harder to deliver enough oxygen to your body. Non-smokers exposed to secondhand smoke are also at a greater risk for respiratory and circulatory system diseases. So secondhand smoke can cause you just as much trouble as if you smoked yourself. Studies indicate that children of smokers are twice as likely to develop asthma or other respiratory problems. Pregnant women who smoke place their babies at risk for many different complications. So let's talk about some of the things that secondhand smoke does. It exposes other people to cancer-causing chemicals such as formaldehyde, arsenic, and ammonia. It aggravates asthma. It increases incidence of ear infections. It causes sticky platelets and damaged blood vessels, and it causes up to 70,000 deaths from heart disease each year. So whatever the age of a smoker, and no matter how long that person has smoked, his or her health can be improved by quitting. So nicotine's a powerful drug with strong addictive qualities that makes it very difficult when someone decides to quit. But the best solution is to just not start smoking in the first place.